Hello guys, this is the first video that we are uploading for the subject of pharmacology, and this will be very basic for the students who are pursuing their bachelor's in pharmacy and those who are pursuing their bachelor's in medicine and surgery. So now we will go into the definition of the pharmacology. That is, if we see into any kind of book, it's written, it's the science of drugs. So what this basically means, is this everything that we need to know? No. I will clear you the concept, what basically the pharmacology means, what science that are we dealing with, and what terms does it include. So first thing we need to know is the definition of pharmacology. So as I said, this is the science of drugs. And firstly, if we need to know what basically the term drug means. Now, what is a drug? A drug is any substance or product, any substance or product, chemical. This is very important. Any chemical substance or product that is used or that is intended to be used, intended to be used, intended to be used to or to modify or explore physiological physiological systems or pathological states for the benefit of the recipient. It's a very big definition of the drug. That what drug means is it's simply a chemical substance or product that's used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipients. Now let me explain it in very simpler terms. So this is the WHO definition, and it is same in all books. Okay, so we also have a WHO definition for pharmacology as well. So we'll not go there. I will just make you explain. I will clear you the concept regarding pharmacology. Now here we can see there are two terms: physiological systems, very common term, you know it. All the these processes that take place inside the body. This body, the wholly, is termed as a system, and all the things that take place inside the body are called as physiological processes. Similarly, there is another term that is pathological states. What is pathological state? Pathological state. Now let me explain it. Pathological state is nothing. It's just when, very simple terms, I will tell you, when the body is in a state of a disease, is in a state of a disease. Okay. So if the person is suffering from any kind of disease, and in that very case, what we give to the patient, what we administer to the patient, and that substance shows a proper pharmacological effect or physiological effect. This will make you understand everything. That will produce a physiological effect. Physiological effect in the pathological state. Physiological effect in the pathological state. So, for example, we'll consider a pathological state. For example, if a person is suffering from high fever. So this is a pathological state. We don't know the reason why the person is suffering from high fever. We need not to go there. Just a person is suffering from high fever. So what we do, we give him a very common drug, that is PCM, paracetamol. And what kind of physiological effect will it show? It will decrease the body temperature. and also it will decrease the pain, if any. Okay, so the patient was suffering from high fever, and what we did, we provided him with a chemical substance that is paracetamol. And what it did, it showed a physiological effect, a proper, a significant, a very decent physiological effect, that it decreased the body temperature and showed us a proper and showed as a specific benefit in the health state of the recipient. That's why I wrote here, for the benefit of the recipient. So this is the definition of the drug, and this will eventually clear you what is pharmacology and what kind of substance do we study in it. Those substances are called as drugs, and drugs, I have put here the definition and I have explained it, what physiological state is and what physiological effect is, what pathological state is, and how it shows the benefit. Okay. So similarly, we have different kind of drugs, like we have antibiotics, we have anti-inflammatories, we have anti-arrhythmias, we have anti-hypertensive drugs, we have anti-angina drugs. So many drugs are there, and every drug we see, every drug, they show a proper physiological effect. Every drug, they show a proper physiological effect. Okay. Now, another term that we need to, no, no, not another term, another thing that we need to consider is that we have, for example, we take alcohol in drinks and caffeine, caffeine as well, we take them. So can we consider, since they also show a little physiological effect or sometimes major physiological effect, so do we consider them drugs? No, no, not when we are taking them usually. I already explained it. Only in the pathological states a substance can be called as a drug. We cannot give drug to anybody who have normal physiological status. So in this case, these are not regarded as drugs. Generally, it must be a pathological state, a pathological state. Now, what base things do we study in pharmacology? What base terms do we study in pharmacology? So there are many things. For example, we have, I will just make some circles here for your understanding. So first thing that we study inside the pharmacology, inside the uh, definitions of pharmacology, or the terms related to the pharmacology, or what we have to deal within this pharmacology. Many things we study. For example, it's all related to drugs. Okay, this is all related to drugs. Now, what we study, number one, is how we administer, how we administer the drug. Okay, number one. By this I mean, what are the routes of drug administration? For example, whether we provide it orally, whether we provide it intravenously, IV, okay, whether we go with the suppositories, or we say intrarectal. Okay, so these are the different kinds of routes. For example, whether there are so many routes of administration. So these are just the basic. In orally, we have different kinds of these types of substances that we give. Some are chewable, some are put under the buccal cavity, some are ingested. So different types of. And number third, we see. So this is administer, how we administer, and routes, that includes the routes of drug administration, and we see in which form. For example, is it a tablet? Is it a infusion? Is it an ointment or extra? So these are the things that we that we learn inside the pharmacology. It includes all these terms like administration of drugs, how we, what kind of routes do we employ, or these, what are the, even what are the sources of the drugs, what are the sources. We also come across these terms inside the concept of pharmacology. For example, if I say like the sources, whether the source is animals, bacterias, whether it is synthetic or anything else. And furthermore, we see it also includes drug nomenclature, how we name a drug. Like you have must have studied in your plus two levels IUPAC. I'll not go deeper into this concept. I just wanted to clear you the concept of pharmacology. So these are, we also have this drug nomenclature. We also have a system for it that names the drugs universally, and it also includes the list of for number one, list of essential drugs, list of orphan drugs, and all. I'm just giving you the concept. Later on, we will discuss each and every term very precisely. And there are so many terms that are related to pharmacology. And the most important being that we will discuss is number one is pharmacokinetics, and number second is pharmacodynamics. So these terms we will be discussing in the next lecture, and we will also discuss other terms like pharmacotherapeutics and the pharmaco. We have so many terms, ethics. We have so many terms related to it, clinical pharmacology. Those terms we will discuss in the next chapter. Thank you so much for watching. Have a nice day, and please don't forget to subscribe.